Dr. Taggart, when you say autism treatment team, could you go into a little more detail on what exactly that team is made up of, who the professionals are on the team, the role that they play, and how they all work together to help patients manage the symptoms of autism?
Sure, Adam. So I'd first say that there's such a wide range of symptoms and struggles in the constellation of symptoms that we see in autism that there's really no one professional whose, areas of expertise can cover it all. So that's really why we need a treatment team. And while you'll see me be talking about a fairly wide range of professionals in the treatment team that is right for the proper treatment of an autistic child. Um, so probably best to first talk about child psychiatrists and child psychologists. They are the two professionals who are most trained in first diagnosing autism so that we're sure to get the diagnosis right in the beginning to know that we're truly dealing with autism. Secondly, their training gives them the ability to have the bird's eye view of all of the autistic symptoms and struggles that we see, and to know thus who are the professionals that are needed to be brought into play for this autistic child with this range of autistic symptoms. So, the first professional that I would talk about next would be speech and language pathologist. And so they are very skilled in addressing the communication and language difficulties that we see in autism. And that doesn't necessarily just mean verbal difficulties. It doesn't mean, pronunciation issues or word finding issues. It can uh, often be that they're highly skilled and doing a lot of work targeting also the nonverbal aspects of communication that can also loom large in the struggles of autism. So the next professional to talk about, I would say, would be an occupational therapist. And that's somebody who is really skilled at treating a couple of areas, at targeting a couple of areas. One is the excessive sensitivities that we pretty commonly see in autism. This can be sensory sensitivities to things like sound or texture, and can often go along with emotional reactivity. Like if they run into a sound that really bothers them, an autistic person can often have a lot of emotional reactivity to that. Second thing that occupational therapists can very commonly help out with is the fine motor skills and dexterity issues that are often seen as part of the constellation of autism symptoms as well. The next person to talk about is a behaviorist. Behaviorists can help with a bunch of areas in autism that are areas of important struggle. One is the rigidity areas, and that's an area that also is sometimes termed inflexibilities in autism or obsessiveness in autism. And essentially, that's uh, the struggles that autistic folks can commonly have with changes in routine uh, uh, or variation in the way something is done that can be often very much more upsetting to them than it can be for neurotypical folks. Behaviorists can also help with disruptive behaviors and the emotional reactivity that can go along with those disruptive behaviors. And this, I think, is an important area to highlight for families in that disruptive behaviors and the emotional reactivity that can go along with them can typically be one of the biggest symptom groups in autism that is keeping the autistic patient from entering the social mainstream. That it's typically a barrier for them socially. And if this is improved upon, and a good skilled behaviorist can often improve upon this greatly, then these symptoms can often uh, be diminished enough to allow the autistic individual to move back at least towards the social mainstream, if not into it. So that's an important one to talk about, but they're all highly important. The next important one is the special education professionals. And these are special education teachers and education therapists who are at the child's school, and they are there to deliver services for children who have designation as special education children and who are diagnosed with autism. Special education teachers are very skilled at shaping the educational material so that autistic folks who do have different ways of thinking and processing than neurotypical folks do often. These special education teachers are reliably good at structuring the educational material so that it's appropriate to the needs, appropriate to the ears, appropriate to the brains of the autistic kids who are receiving that education so that it really sinks in better. And special education therapists are typically occupational therapists and speech and language therapists who can augment the speech and language therapy and occupational therapy that is being given typically by professionals in those areas in the community as well to the same child. So they can be uh, helpful in delivering added services in those areas. So another professional that I think is important to talk about is a social skills therapist. And this is a therapy, social skills therapy, that is typically done in groups. Um, and the social skills therapist can often be very effective at helping what is generally thought to be the most core symptom of autism, social difficulties, helping those symptoms move in the right direction. And these social difficulties can be of many different forms. They can be uh, deficits in social cue awareness, deficits in just social savoir faire, just a gut sense or a knowledge of how to act in certain situations that can not uncommonly be be off for folks who struggle with autism. And so there are, anyway, many other areas of social skills struggles for kids with autism, and a good social skills therapist can help out greatly with all those areas, Adam. So now I think it'd be a good time for me, Adam, to come back to the two coordinators who I talked about earlier, the child psychologist and the child psychiatrist. So in addition to their role of coordinating the care and seeing the kind of 30,000-foot view of the need for all the professionals who need to be involved, there's some specific roles that they can be really helpful in. One role I think that's important to talk about for child psychologists is they can be very helpful in further clarifying the diagnosis. So if there's any lack of clarity around the diagnosis, for instance, if we are wondering, does this child have autism? Is there any question about whether they have autism or not? Then a child psychologist is going to be able to administer testing that can really nail down the diagnosis and be much more certain about it. Child psychiatrist can be important in a specific area too, and that is in the area of medicating, if appropriate, where medication would be, most professionals I think agree, in autism is in probably three areas. One is the area of great emotional reactivity, and sometimes in its more severe form, agitation. There are medications that can help greatly with that. Secondly, the area of rigidities or inflexibilities. I think I mentioned earlier that can sometimes be referred to as the obsessiveness that we'll see in autistic folks. And the third area is attention and focus and hyperactivity difficulties. As people may be aware, that is seen in the condition ADHD, or attention deficit hyperactivity disorder. And that is a condition that is not considered part of the symptom groups in autism. However, it is a condition that we do see commonly co-occur with autism, or go along with it. And so it's important to talk about, I think, for an additional reason. And that is that when attention and focus difficulties are looming large for an autistic child, when they really have great struggles with attention and focus and with excessive activity, that can really get in the way of a lot of the therapies that we've just talked about in this interview, Adam, working well. So, conversely, when we can succeed in diminishing attention and focus and excessive activity difficulties, that can really reliably make that child so much more receptive to the therapies that we've talked about, everything from occupational therapy to speech therapy. In other words, if they can pay attention to the good coaching and advice and training that they're getting from these different professionals, if they can absorb it and and focus on it better, then it sticks better, and we see a lot more global progress for these kids. So this can be an important area to talk about, and it's an area that medications typically are used for. There are other therapies that can help with attention and focus hyperactivity difficulties, and we can perhaps talk about those in another interview, Adam. But this is an area where prescribing by a child psychiatrist can often be helpful. So there's the autism treatment team. I hope that's helpful for families of autistic individuals, and it's an area that I think is very important to talk about, because that there is so much typically that's going on as far as the struggles in autism, that no one professional can treat it all, and so it's really a case of it takes a village, and that's the message that I hope to get across to parents, to be sure that they're involving all the professionals that can be helpful in this diagnosis.